Hello everyone, my name is Arturo Barona and my presentation today will focus on global infertility. So here we have a quick outline of how the presentation will go. First we'll talk about some background information, then we'll move on to the epidemiology and pathophysiology of disease. We'll talk about some of the different causes of infertility. Then we'll lead to the diagnosis and treatment options that are currently available. We'll also talk about risk and protective factors for infertility, and then we'll also talk about prevention methods that are currently in place. Lastly, we'll talk about public health impacts of infertility and how that can affect our day-to-day lives. So with an aging population, a lot of current efforts focus on age-related diseases as well as sustaining an overpopulated world. It's important to emphasize that the older populations are sustained by the younger populations. And so it can be dangerous when people aren't reproducing enough to replace those older generations that are retiring from the workforce. Baby boomers make up a large portion of the world's population and actually account for an estimated 20% of the total population here in the US. We are already starting to see the increased burden that they place on the healthcare system. And so it's important to focus on any of the aspects that may contribute to that burden. In this case, infertility. So there are two specific types of infertility. One, primary infertility, is when a woman is unable to ever become pregnant or carry a pregnancy to full term. And this is a global rate of about 2%. The other form of infertility, secondary infertility, is when a woman is unable to become pregnant or carry a pregnancy to full term after already being pregnant before, at least once. And this counts for about 10.5% of, this has a global prevalence of about 10.5%. And so it's also important to mention that infertility in itself is not a significant physically debilitating disease. However, it's often reported by many people who are infertile to be one of life's greatest stressors. It is known to cause a variety of psychological symptoms that will later be discussed. And so we are beginning to understand that infertility has a lot of major implications, that it has not only an individual's personal life, but society as a whole. Over recent years, there's been a movement on how infertility is described, or has gone from being described as a medical condition with psychological consequences to one that is more socially constructed. Here we see that infertility has a prevalence rate of about 9% worldwide, but only 56% of that population actually seeks treatment. So we see that a large portion of infertility cases actually go with no treatment. The percentage is also higher in more developed countries than developing ones. This can be due to a couple of factors. One, there may be a lack of surveillance in developing countries, which may contribute to that data. Or women in developed countries are also more often highly educated. They focus on living a more independent life, and they're more likely to focus their time on work or accomplishing any personal achievements that they may have. It's also important to note that the trends in infertility have remained pretty consistent since the 1990s. This means that research should be focused on biological and genetic factors just as much as environmental ones. Infertility is also often thought of as a woman's disease, but it's important to emphasize a male's role as well. It's reported that women are solely responsible for about 70 to 80% of all cases, while men are solely responsible for about 20 to 30% of all cases. This can obviously vary by region, as we'll see in the following slides. But some studies also show that men may partially contribute to about 50% of all cases. So here we see that the global prevalence of primary infertility. we see that there's a higher prevalence in parts of Africa as well as the Middle East and Eastern Europe. This may be due to, like infrastructure or limited access to healthcare. Some countries may also choose to use the resources to, combat other issues and give less attention to fertility. Here we see the prevalence or the global prevalence of infertility, of secondary infertility. Just by looking at the Western Hemisphere, we see that there's a slightly decrease in prevalence. Here you can go back to primary infertility, and we see how there's less shading in the Western Hemisphere overall. We also see that there's a slightly lower prevalence in parts of Africa as well as the Middle East, but we do see a higher prevalence in Europe, especially the eastern part of Europe. This image also illustrates the global percentages of infertility cases due to the male factor. And here we can see that males significantly contribute to infertility in parts of the Middle East as well as Europe. And so there are many different forms of infertility or conditions that lead to infertility. Tubal factor infertility is the first one that we have here, and this refers to problems with the fallopian tubes. There are two main types of conditions in this category. For example, one is in which the fallopian tubes prevent sperm from reaching the ovary to fertilize the egg, so no fertilization actually takes place in the first place. There's a second form where sperm is able to go through, reach the egg, and fertilize it. But then this fertilized embryo can then not pass back through the fallopian tube and enter the uterus. And so this prevents the pregnancy from being carried out to full term. These conditions are often caused by some form of blockage. There's also uterine factor infertility, and this refers to problems with the uterus, uterine fibroids, or scar tissue that develops through like the result of surgery or trauma even. These type of things can distort the anatomy and functionality of the organs, which can ultimately lead to infertility. There's also ovarian failure, which involves the improper release of eggs. Ovarian cancer, or any type of cancer really, including breast cancer, can significantly impact one's health. There's also menstruation disorders. There are some hormone imbalances or even genetic disorders that may lead to infertility. Lastly, but certainly not least, there's sexually transmitted diseases such as HIV that decrease one's immune system and lead to a variety of health complications that as well ultimately cause infertility. So the World Health Organization, their official definition of infertility is a disease of the reproductive system defined by the failure to achieve a clinical pregnancy after 12 months or more of regular unprotected sexual intercourse. And so there's a variety of tests that exist to help medical professionals come to this conclusion. For women specifically, there's imaging. This can be ultrasounds or hysterosalpingographies. I have a problem saying that word. But this is when X-ray contrast is injected into the uterus and scanned for any type of spillage or blockage. And there are also slightly more invasive types of imaging, such as hysteroscopies as well as laparoscopies. There's also ovulation testing done through blood screens that test for any hormone or biochemical imbalances that may lead to infertility. There's also ovarian reserve testing that counts the amount of eggs a woman has. There are also tests for men. There's a semen analysis through which they perform a sperm count. There's also hormone testing, which tests the levels of different hormones such as testosterone. And they also have imaging. They also do ultrasounds or imaging specific parts of the body, such as the vas deferens, that play a significant role in reproductive health. There are also very different types of treatment options. This is really done on a case-by-case basis and really depends on what causes infertility in the first place. So there have been a lot of medical advancements in the field of assisted reproductive technology. In vitro fertilization is the most commonly used and it's the most effective. This refers to when fertilization is done outside of the body and then transferred into a healthy uterus. There's zygote intrafallopian transfer, which is when fertilization is also done outside of the body, but it's transferred into the fallopian tube instead of the uterus, like the more traditional method. There's also a less common method, the gamete intrafallopian transfer, which is, or it involves the transferring of eggs and sperm into the tube and allows fertilization to happen inside the body. There's also ovulation induction, which is a less invasive method, and it refers to the stimulation of ovulation by medication. This is commonly used when infertility is caused by hormonal imbalances. There's also the use of gestational carriers, and this treatment option is for women with a completely non-functional uterus, but they still have functioning ovaries. So this involves, or refers to when an egg is taken from a woman and fertilized with her partner's sperm, and then that fertilized embryo is implanted in a carrier's uterus, which, as the name implies, carries the baby to full term for the couple. There's also the option of surrogacy, which is for women who don't have any eggs available. A woman agrees to get pregnant using a man's sperm. And so, like I said, this is for women who don't have any functioning eggs. So the baby will be genetically like the surrogate and the male partner, but not like the female partner. So now we'll talk about some of the risk factors associated with infertility. These can be categorized into previous history or lifestyle factors. STDs, type of pregnancies, cancer, age. These are all known risk factors for infertility. And so they each change the human body in different ways, some more significant than the rest. And there are also lifestyle factors that cause infertility, such as, for example, smoking can lead to changes in DNA. Substance abuse can cause changes in hormone levels and cause addiction problems, mental illness that really don't, or they lead to infertility. There's also a body mass index. High BMI as well as low BMI is known to be a risk factor for infertility. And this causes, physiological changes in the body. Low BMI is actually a higher risk factor for males than for females, as some studies show. In general, it's best advised to live a healthy and balanced lifestyle. So we'll talk about some of the more protective factors in the next slide. So education is a huge protective factor. It not only increases primary prevention methods, but, which we'll talk about in the next slide, but more highly educated people live a healthier lifestyle and they're less likely to engage in dangerous or unhealthy behavior. Access to healthcare is another protective factor, as regular follow-up with a healthcare professional allows people to live healthier lives. It increases the chances of early detection of the disease, which, in general is likely to give people more likely of success of getting through that disease. So the life course perspective, teaches us that living a healthy life gives an individual the greatest odds of survival. We know that the health of a baby isn't only determined by the mother's behavior throughout the prior year of the birth of a child, but it actually starts years before, and so it's a result of positive choices made throughout their life. And it's an accumulation of those choices that usually determine how fit the couple is to carrying out a pregnancy. And so here we'll see some of the different prevention methods. Primary prevention methods involve avoiding a lot of the risks that we talked about, such as avoiding drugs or smoking. It also involves keeping good hygiene and participating in healthy sexual practices. Secondary prevention has more healthcare interventions. It involves routine health checkups and screening. Like I said earlier, early detection really gives individuals a higher percentage of success, for overcoming any condition that they may have. And then lastly, tertiary prevention is really involves the use of any treatment options that we discussed earlier, to actually procreate. And so there are a lot of public health impacts that should be considered. For example, stigma. There's a large amount of stigma around the topic, and there's a lot higher emphasis on female fertility as opposed to male. Some studies actually show that up to 1 in 5 women report experiencing some form of discrimination or prejudice due to the fact that they're infertile. And so this can cause a lot of mental illness, feelings of guilt, shame, depression, anxiety, sadness overall. They tend to lead to lower self-esteem. People may struggle to be confident, and this can really impact all aspects of their life. There are also economic implications of infertility. A decrease in the number of people entering the workforce may make it difficult to sustain those older generations who continue to retire. And so, it's important to keep procreating in order to sustain all generations. So future work should focus on prevention methods that increase educational awareness. This should also focus on maternal and child health. A lot of the causes of negative symptoms around the world are due to modifiable factors. And so the world's most vulnerable population should be a focus of efforts, because some countries, due to the lack of infrastructure, may not be able to help these individuals as much as more developed countries are. Reproductive health is a broad field that focuses on a large range of topics that sometimes even share some overlap. Advancements in one aspect may lead to advancement in another. So it's important to always keep a collaborative approach, Lastly, although we have come a long way in treatment options, there's always room for improvement. The efficacy and safety of current treatments should continually be investigated for improvements. So here are some of my citations in case any of you are interested in doing some more reading. And I'm happy to answer any questions or comments. Thank you, and I hope everyone is staying safe.